Yeah, man. Carry
I like him want to draw Patrick tongue, Patrick not pay no
yeah,
mind.
not pay no mind because I'm eat.
Okay.
I try to draw your tongue, Patrick.
All right. Well, let's, gentlemen, we're live now, and I want to say good evening to the listeners. And before we start, wait, I just want to do something here. Okay, there's some folks who I want to ear up and say hi to them. Gloria Morris, she's a faithful listener. Mr. Beckford, Legis Beckford, also another, consistent listener. Elaine Turner, yes, my sister, bless you and bless all of you for joining us today, Sunday at the round table. My name is Mike Nita. I'm your host, along with Patrick McCarthy, a community activist from Jamaica, Mr. Brother Las Crawford, another community activist from Jamaica, Kingston, Mr. Jonathan, former General Secretary of the National Union of Democratic Teachers, and he's like our spiritual guide.
Spiritual.
Spiritual guide.
Oh, you're going to fall in the wrong. You're going to fall in the wrong path if it's that you're looking for.
Well, regardless, you just keep on playing your role.
Yeah.
Yeah, and we'll take it from there. Because I know Patrick is not going to let you stray too far.
That's right.
But regardless, folks, man, have you been following the news out of Jamaica?
Yes or no?
Okay, well, if you've been following the news, you would have realized that Prime Minister Ole's name is on the agenda again. I see, say that boy, they receive permission to build 3 apartments and they build 4. So it's like they have no regards for for what's happening, the laws. So that's one thing, and he's complaining a lot about it. The whole JLP is up in arms, which lead me to ask the question I posed. Is it a crisis of the JLP? Herb Nelson is here. Let's add him. Is this a crisis of the JLP or a crisis of something else? And I say something else because a couple weeks ago, a relative of mine was diagnosed with breast cancer. And she should have started treatment like 2 weeks ago. She turned up at the clinic, Kingston Public Hospital, and to our surprise, they could not locate her docket. They couldn't. This is the Kingston Public Hospital Cancer Clinic. They could not locate her docket. The docket was only located after folks went down there and started making up noise, demanding to talk with the higher ups. When they did talk with one of the higher ups at KPH, that individual said, yes, she's going to look for the docket. She went to one room and came back and told the person, listen, my knee is hurting me and I'm not going to climb no stairs. You heard what I said?
Mm-hmm.
No, this is modern Jamaica. You have staff who are paid to do a job and they're telling you that they're not going to do it because they're having leg pain. In the same breath, we heard about the junior doctors' strike. So, the question I ask, and I hope I can get some answer, is there a crisis in Jamaica? Or is it just a crisis in the JLP? Or is there a crisis in the healthcare sector? The strike by the junior doctor tend to support the argument that healthcare service in Jamaica is at a crisis level now, and I think that's the reason why the U.S. Embassy issued that advisory some time ago. But I don't know. I would like to get the feedback from the panelists as to what they think, because the direction Jamaica going right now, the only thing left for us is a revolution to bring change, because it seems like everybody is on a different planet. Gentlemen, let me hear your views. What you have to say. You have heard the news. You heard about this junior doctors strike. You know, the crisis in Jamaica, the JLP, wholeness back on the agenda again. And I think Herb might have some information to share with us on that. You know, so let me sit back and hear from you now. Usually I start with Patrick, but this time I want to start with John. John.
Normally, I thought you would start with Herb. Is the
Yeah, that's what I'm doing.
Go ahead, John.
All right, so let's start with Herb. Herb, tell us what's happening with wholeness and all of that stuff and the crisis down there. What's your take on it?
Let me go back to. Can you guys hear me?
Yeah, man,
yeah.
perfect.
Okay.
Can see you and hear you. Calamity.
When you tell one lie to cover the first lie, and then you gotta tell another lie when the first lie and the second lie start unraveling, what you end up with is a meshwork, a web of lies that you tell, and then you have to go get lawyers to start tracking your lies, and lawyers doing denials on your behalf. This is where wholeness is headed, because as I presented a few weeks back, they're coming around now to the source of wholeness's funds. And when you start hitting on the source of his funds, then you start unraveling the various companies that he's formed in the past. You see where money is coming into different companies, and it's no sourcing whatsoever. So things are unraveling, and wholeness is getting deeper and deeper, as we say, in kimchi, right? Now, I don't know how he plans to climb out of all of this stuff, but the lawyers won't be able to help him after a while. He's just going to owe them a bunch of money. So that is my take on where wholeness is headed. His wife, once they open up the rest of these packets that the IC presented in Parliament, once they hit his wife, then you're going to see some more fireworks, because she's going to have to explain where the source of her funding comes from as well. She, like wholeness, was all attached to all of these companies you see. She was either a director or she was the director basically in all of these companies. And so she has to come up with answers. And it's going to be interesting when they show them that they have them inside a box that they can't come out of. You know, because if you jump from the frying pan, you're jumping into the fire. And that's pretty much what I'd like to say about wholeness for now, Mike.
John, jump in.
Well,
Patrick.
I was trying to remember adage that my mother taught me about the web, about deceiving.
Tangled web you weave. Tangled web that you weave.
Who wrote that poem, by the way?
I don't know if it's a poem. I just learned it from my mother.
Was it Edna St. Vincent Millay? I think my teacher, before she slapped me with the cane, she would let me repeat that. I've never forgotten it.
Oh yes.
Oh, what a tangled web we
Where
weave.
we weave when we try to deceive. That
When
is how it
first
goes.
we practice to deceive. Yeah.
Yeah. So my mother used to tell me that. I don't know if coming out of the same school that your mother taught you, but it's a good example, I think, of what you're saying in regard to wholeness, and it's inevitable that it's like quicksand.
Yeah.
You know, you get stuck with one leg or one foot, try to dig out with the next foot, but you find that the next foot going down and you will be sinking over time. I can comment, or I would like to comment certainly on the health crisis and the example you gave, because you should have mentioned, as far as I know, that the person that went to the hospital, this is a person with diagnosed with breast cancer, went to get treatment, and went back several times because they couldn't find the docket. Imagine 2, maybe 3 weeks pass between the first diagnosis and the docket created, and she was scheduled for treatment and had to go back several times. Every time they go back, or every time she goes back, they tell you come back the next week because we cannot find the docket. Knowing how things really are, they probably don't look for it until it became a crisis where the higher ups, and this is how Jamaica run. If you don't have contacts from a higher upper, and you don't have the ability to get a higher upper to put pressure on the next higher upper, dog name your supper. But imagine, breast cancer is like all cancer, become critical the longer you start the treatment. So it's a reflection of the problem with the health system. And although I do not personally agree with all of these, what is it called? The thing that the US Embassy put out.
Advisory.
Advisories, especially when it comes to crime. And based on my own historical experience, when we had the political upheaval in Jamaica and the crime situation, a lot of it, or some of it, was the result of US policy itself, US intervention. And clearly there is a case to be made in regard to the health situation. I can only speak when I visit. I've never been to the hospital recently in Jamaica, but friends who I have, they never speak about going to UWI or to KPH. My mother, who was visiting Jamaica when she passed away, was admitted to the Westmoreland Hospital back in December, late December 2013. At that time, she was having a heavy cough. She had no systematic ailment, no high blood pressure, moderate diabetes. It's not like that was the cause. The cause was pneumonia. And imagine, in this day and age, if you have a severe congestion over a period of time, well, she was quite old. I'll be frank about that. But she passed away in the Westmoreland Hospital, and again, family was there, other family was there. But what I've heard and been informed about is the fact that if you are admitted, you need to carry certain things to be comfortable. You have to wait extended periods of time to be seen, and it's generally a crisis. Only those who have money, who can afford to come to the United States, which most of them do, either because they have the necessary insurance or the necessary pocket. Either way, it's all about money. Here we are in the 21st century, in a developed country, a developing country, and people have to leave if you are in a crisis to go to come to the United States to get adequate treatment. It's a real reflection on the state of things. And I will just say, having read another article about the economy, what was referred to as underemployment was the term being used in that article, that it's a manifestation here. Remember now, the Minister of Finance was recently congratulated, not so much so that he was appointed to a position with the International Monetary Fund. I think as we speak, he might be taking up his position in Washington. And that is because the country was passing the due diligence set by the IMF. And that due diligence means that we are fulfilling the IMF constraints vis-a-vis macroeconomic indicators. However, when we go below macroeconomic indicators and we look at the health system, we look at the standard of living. The junior doctors are on strike over pay. When you read the information, they are behind significantly to the cost of living. And the state of affairs is that the nurses, several of the doctors who are not established in the country have had to leave and take up positions abroad, not just in the United States, in Virgin Islands and so on, where they can get a decent pay. And this is a manifestation of the squeeze with which the Jamaican society is under with the current provisions of the International Monetary Fund. So that's as much as I can say now. I think that there are some comments that we may want to mention in the comments column, but that's my view, present view, that there is a cause. We know what the cause is, and it's not leading us to social development. It's leading us to be congratulated by the IMF and for the head of the government, of the financial system in the country, to be promoted to join the IMF for his good work.
At what cost?
The cost is just what we are saying. The cost is the currency going down, standard of living going down, migration of skilled labor, underemployment, and a crisis in many of the social services. The health system being a key one, because if you education is also another, but the biggest one, the most immediate squeeze is in regard to the health system. If people cannot get treatment or cannot afford or cannot get the adequate treatment, it's going to show in the um, some of the macro data in the months and years to come.
But John, the JLP promised us a better service and health service. That's what Tufton and those guys promised us. But what we are seeing now, rather than better health service, we see all these guys getting rich from the very same health service, you know. So what's really going on? What's really happening?
Let me interject for a second, Mikey. Well, just like here in the US, when you need improvements, they don't exactly turn to government for improvements. Who do they turn to? They turn to the private sector. And the private sector is the one that has been digitizing America's records in government as well as in the private sector, right? Now, if you look at the notes I put, the Jamaica hospitals still have paper records. And the question is, why have they not been digitized? Well, they just started at the Maypen Hospital to try and modernize those records. Once you digitize and they are in the system, just like your driver's license or your voting registration and stuff like that, then they don't have to worry about you moving from Kingston Public Hospital out to Savannah Lamar Hospital in Westmoreland, right? Or anywhere else. Because all they have to do is call up the records. If they store the records in the cloud after digitization, then your records can be pulled down in New York City, it can be pulled down in London, or anywhere you travel to. So the bottom line is they have to digitize and get the records modernized so that people can have access to the current records. When I say current, I mean if you took a blood test in Philadelphia, and let's say Patrick went down to Kingston, and he has access to his records, right? Then he can enter his ID and his password and pull the record up for the nursing staff in Kingston. So you have a lot of improvements going on here in the United States that has not touched Jamaica yet, right? Jamaica just yeah.
The thing that I see is that it's not about the possibility, whether the thing is possible or not, because for years now, the technology is such that even if you don't have like government-wide or country-wide digitization, the technology is such that in the local hospitals themselves, if there was will, if the government and the administration had the will to do these things, they could do them because the technology is there. It don't take no whole heap of technology to save information on a disk in a particular department or in a particular hospital so that it can be shared. Even if you have paperwork taking place, it doesn't take a mountain of tasks to save these things, on the computer. So it's about will. John raised the issue of the history of most of the hierarchy of the government or of the governments of Jamaica and the hierarchy of the country. They have been used to not accessing the services of the local hospitals when something bad happens to them health-wise. Most of these people, they are used to, if something happens, they fly to Miami, they fly to New York, they fly to wherever. out of the country and access good medical services. So they have not had the will, most of them, to really improve the health services. Because if we look at the health services in Jamaica over the years, it's not just about this government. It has, or this political party. It has been happening right through the years, through the 70s, through the 80s, through the early 2000s up to now, where the health sector has shown very little improvement. If you look at the number of hospitals and the quality of service and the resources that is present in the hospitals today, and you look back through the 1970s and the 1980s and the 1990s, you have to be wondering what improvements have taken place, right? Which is showing that the successive governments, whether them be PNP or JLP, have done very little to improve the health sector. They're talking about losing the best brains to foreign countries. If you look at it, if the health sector has not improved, whether in terms of its infrastructure and working conditions, pay, remuneration, all of those things, what you're going to have, you have every year, you have a number of doctors, a number of nurses, a number of other professionals in the health sector leaving universities, leaving the colleges, and where they're going to go? They are going to pack up in the limited spaces in the same amount of hospitals, the same services. Where are they going to go? If you don't have the capacity to absorb these people and you don't have the facilities and the accommodation for them and you don't have the wages to satisfy them, why should you expect that these people are going to stay in Jamaica? They're going to go elsewhere that can accept them. You have the same size hospitals, the same amount of primary care clinics, right? So each year when these people come out, all of them, you expect that all of them is going to pack up in the same places, offering the same services and getting the same low wages. It has to be some kind of will on the part of the governments, right, to expand the healthcare services and expand the sector and improve the facilities. I read a report from 1991 to 1996, a World Bank report, and the person was saying they were like, I think, 372 primary care clinics and 23 hospitals in Jamaica, and breaking down the health infrastructure in Jamaica. What has changed now? Nothing has changed. It's the same amount of clinics or less, because as I understand it, some of the clinics have closed, right? So it's the same infrastructure or less, right? So how are you going to improve? The population is growing, right? So how are you going to offer improved services to an increase in population if you have the same resources to spread out amongst all of these people? It's not going to work.
Now, I
Let me
want
let
to
me
say
let me
last,
let me say
I,
something here. Let me say
just
something here.
just one
If
little
I may, Eric.
correction, Pat. 1 second. Last,
Yeah.
a doctor's office can save a patient's records on their computer, but in a hospital setting, where you have not just hundreds, but perhaps thousands of records, the computer will have to have space reserve in the cloud, which we know Jamaica don't have a lot of cloud
or in
space,
a server somewhere.
right? But they have to have a backup system to put those records. So it's good that they have this new thing, the e-care system, which just means electronic care system, that they're bringing in now, and hopefully they do have, like what we see here in America, all of these large buildings with no windows, right? Or maybe one or two windows, and it's humongous monstrosity. This is the thing that I'm seeing popping up all over my home state here in Virginia and in some other states. And that is represents the cloud. This is where they're gonna store your data. So that is what Jamaica has to come into. The reason why you haven't seen a lot of it in the Caribbean is because of weather concerns. Because whether the hurricanes or earthquakes will tear down them buildings, right? And that's a huge concern. So they have a lot of problems, but rather than go above ground, the alternative would be to go inside the mountain. And that is a alternative Jamaica has. That they can go inside the mountain and store the data there. Yeah.
Patrick,
Sorry, Patrick.
Yeah, let me try and put this in perspective, because we started out on one thing, but we have broadened it to a number of things. All right, going back first to your how you started, Mike, and looking at the whole matter of Jamaica's health system and the matter of the Prime Minister and his
business.
his situation with the Integrity Commission. One of first, as far as the Prime Minister is concerned, nothing that we're hearing now. We're hearing for the first time. Right? This is all things that we have been talking about, been discussing, and all of that. Right? But just simply waiting to hear it officially come out from the Integrity Commission. Of course, when that report finally came out, right, and the Prime Minister tried to deny any involvement, which seems so ridiculous because his name is all over it, right? And basically, what it explains is that he cannot account for the massive inflow of funds, right, into his personal coffers. And the fact of the matter is that when you see situations like that, it spells corruption, right? And he has not been able to explain any of this, and wanted the courts to defend him in this. So he took the issue to the courts. Of course, that backfired on him. And we're back at the situation where now the Integrity Commission is, letting out a little more to the public. But none of this is new, right? And the situation remains the same, where the JLP government is just corrupt from start to finish, right? And they're not done yet, right? And it starts at the top, because that's where a lot of it is taking place. Regarding the situation with the hospitals, right? And I say hospitals because here we mention the Kingston Public Hospital, but it's not just the Kingston Public Hospital. It's all public hospitals across the country, It's problems within the whole healthcare system. It's not even an industry. Here, when we start to compare, we have to understand what we're comparing. Right? Here in the US, right, you're talking about healthcare industry. In Jamaica, it's not a healthcare industry. Right? It's a healthcare system, right, which is poorly managed because the problem begins with the administration. Problem begins and ends with administration, right? And it's poor administration. And yes, to Lass's point, right, this is something that has existed for decades, right? This thing go back several decades, something which we understand. Now, one of the crucial points to mention is this, that when you see situations like that, like here in the US, what you find is that the healthcare industry is owned and operated privately. It is a profiteering matter. So that alone spell a big difference. Right? In Jamaica, right, the healthcare system is one that is administered supposedly by the government, right? Set up under statutory bodies. But the fact of the matter is that these are not efficiently run. It's people collecting money under false pretenses because there's no proper management, no proper administration. So you see all kinds of flaws, all kinds of weaknesses. The problem is not the docket. The problem is not the docket system and them keeping records and all of that stuff. All of these are matters that can be addressed and should have been addressed, right, over the years. Right? But it ties in with the other subject, which I guess we'll get to in our discussion about with that other sister's article in the Gleaner about economic development.
Rosalie Hamilton.
Yes. But one of the things we have to understand is that the problem is one that is put on the backs of the Jamaican people because they are the ones who suffer. When there is corruption, who suffer? The people suffer. When there's when you have a poor health system, it's the people who suffer. So yes, Mike, they rely on promises at election time and all of that, which are empty promises, because it suits the politician to have these conditions and then make promises, right, to gain votes. But the fact of the matter is that the people become more desperate when they don't see no improvement and them look for more promises. But promises is not what fix it. So we can get into that some more. That is really what we need to be speaking to. Right? This is where it calls for people to really wake up and understand and realize what they're living in, the situations that they're living in. Right? Not just to bear it, but how it is to be addressed. Understand how it is to be addressed. Right? There's no savior coming to save anybody. Right? It's things which we're going to have to take as our own responsibility to deal with. But that is another discussion that we need to get into.
I hear you, Patrick. I hear you, but I am asking myself. Yeah, we need to get into all sort of stuff, but where is the leadership? Where is the leadership?
We generate the leadership. The leadership have to come from us. Have to come from the people. That is why people have to take it as their responsibility to learn and understand what's taking place, right, and how it is to be addressed. Because that's where leaders emerge.
Let me hear from the others now. This question of the leadership. Yes, we see what's happening in Jamaica, and people are asking why there's not a revolt or uprising or something. You know, that is constantly on the minds of people. But where is the leadership? Where is the leadership? I listen to the People's National Party, and they seems like they're more say, let's just sit back and watch the JLP fall on their own sword rather than engaging the people. So where's the lead? I throw that out there. Anyone can answer that question, John?
Mikey, when you're looking at 14 members of parliament compared to, what is it? 14 from 63 leaves how much?
49 or something like that.
49, yeah. You can't interfere with the running of the government with 14 people. You can't impact it. You can use your voice and try to be a bully pulpit, but it's not going to change anything. Because if they have a case in point, they submitted the same flawed plan for vote that they have to change the constitution. Just been submitted. All because they want to be able to say around the time that the election comes up that they submitted a plan to get from underneath King Charles, to discard the king as head of state. But it's not going to work because the plan is flawed. And the people of Jamaica, the intelligent people of Jamaica know it's flawed. And I don't think the other people don't even bother to think about it because they have very little interest in it. It's not going to put more money in their pocket whether they're under the king or not. So they don't even want to think about it. But this is what's been going on. And it persists. So I don't see how whether Mr. Hilton or Marky G or anybody else that wants to do something will be able to do it unless they win the next election outright. And then they necessary changes. Yeah.
That's why we have to start from where we are. Because you're broadening it now to include something else, which is another subject again to itself. Right? Because this when somebody's sick and them go to KPH, them not think about the king in England. That's not their concern. Right? What their concern is that them want to get healthy. Right? Them want to be able to come into a facility that can help them. Right? So the first thought that is gonna come to their mind is their representative on the ground. Right? Whether it be councillor or member of parliament. Right? Bringing them to account as to how it gets taken care of. Because understand, everything runs like on a tier system. That is how capitalism is set up. It is run on a tier system. Right? Your first line is the line of your representation. Right? That's the person you vote for. And if whether that person is JLP or PNP, it doesn't matter. They must be held to account. If you're not holding them to account, then nothing can happen.
If we look, Patrick, at what has been happening with our electoral process in Jamaica, it tells us something. The fact that over the last number of election cycles, you have less and less people participating in elections and participating in the concerns. Because while it's about elections, it's also about people's concerns about what is happening in the country. And the trend towards people copping out of the electoral process tells us that people more and more feel like this system that is present in Jamaica is not benefiting them and it is not setting up anything for change. So when it comes to leadership, if the leaders gonna inspire people to do something about what is happening, it have to be along some different path than it has been taking place up to now. Because the part that it has been going up to now is causing people to cap out of the system and just feel like, say, boy, I'm no business with that because it not bring me no benefit.
That's a
Right?
part of police.
And the
But that's
political,
but that's
all the political arguments that we're seeing on the table is
But that's
about,
the whole point. That's the whole point. Last. That's the whole point. I mean, you put it squarely on the head. The fact of the matter is that with less and less participation, the result is that we have a more flawed system,
definitely.
right? Because the more we consider ourselves, you know, totally ignorant or totally, oblivious of what's going on, right? Is the more it's gonna be, in total chaos and lack of accountability and all kinds of crap taking place.
And the problem with that, Patrick, the problem with more and more people copping out of the system is that what it does, it gives the politicians, the people who are elected, the feeling that them have sole control and sole power to do
Exactly.
whatever they want to do.
Exactly.
Because there is less people putting pressure on them. There is less people. Look at the corruption that is taking place in Jamaica with Andrew Holness and his wife and all of the people in the JLP. And look at the response from the Jamaican public. Instead of us seeing some kind of uprising, not like uprising to damage and burn down place and all of that, but I'm thinking of uprising in terms of people. You hear people talking consistently and loudly about the corruption and in particular of the prime minister and those people. People are saying nothing, right? So the fact that we are not a course where the political system is not making people enthusiastic for participate, right, is giving the politicians more power to be corrupt, more power to be negligent, more power to do the same things they have been doing all along, right? So until we have more grassroots participation, until we have some alternative to the present system that is happening, right? The present political system, we're going to have more of the same. For me, my problem is the the proposals coming from the PNP. For me, it's not substantial enough to change the conditions of the Jamaican people. Of course, yes, the PNP has made proposals that show that they can do some things differently from the JLP. But it's not just doing things differently from the JLP. It's about doing things differently from the system we've been having all along. And that is where my disagreement with the PNP is. The PNP seem to be putting proposals to do something a little bit different from the PNP, but the system, right, the way how the country run, right, it's not about changing that. And that is where we need the change. We need a different course of doing things, a different course of holding people accountable, right? A different course where people can participate and make direct proposals and see it implemented inside of them communities and inside of the government. We're not thinking about a system where just the politician have a voice and just the politician have ideas as to what he wants to do and him do it his way. We are talking about a system where you have more full participation of the people, right? And the people can feel that, yes, we made these proposals in the community and we see it implemented. We made these proposals about government and we see it implemented, right? We have difficulty with a particular politician and we voice our opinions about it and we see change. Right now, the political system, whether it is being offered by the JLP or the PNP, don't offer those kinds of possibilities for the vast majority of Jamaicans. And that is where I think the changes need to come.
So tell me, you'd agree that there's a crisis in Jamaica? In
Of course, there
JLP?
is a crisis in Jamaica, but the crisis not just start, Mikey. We have
Okay.
a crisis in Jamaica for decades. We have crisis under the PNP, under the different JLP government. It's not now the crisis there. What the problem is that nobody, we don't see people are rising, we are going to lead us out of the crisis.
But it is even bigger than that, lass. It is even bigger than just not seeing people. The reason why we're talking about a crisis now is because, first of all, this is where we are. We are at this point in time, right? Regardless of what happened in the 70s, the 80s, the 90s, right? We're at this point in time. And when we look at the state that we are in, it has never been this terrible. As bad as it has been at KPH, it has never been this bad. Right? Because we're looking at it now. We're looking at it now with fresh eyes, presently. Right? We don't need to look back. Right? We don't need to look forward. We have to look at now. This is the situation that faces us right now.
I want to just add a point here. And I thought about what is being said, and I'm reminded of, well, I just wrote down a phrase, and the phrase I wrote down is very
Easy to talk.
no, very real. It's a real situation in Jamaica. When we talk about a crisis, we are looking at it and we are living overseas. Doesn't matter. The point is we perceive a crisis and we ask ourselves, why is nothing happening? Why is nothing happening in the country to demonstrate that people are upset with this crisis? And it reminds me of the following phrase: river water flow according to the way the riverbed is cut. River water now flow no new way in Jamaica. We have two riverbeds. One riverbed is the JLP riverbed, and the other riverbed is the PNP riverbed. And although the water is not flowing,
there's a simpler phrase for it. A scientific phrase for that, what you just said.
Well, let me finish before I lose track. Let me finish before I lose track my thoughts. So we are seeing a riverbed that it was flowing much more, 49 feet, flowing much more in one riverbed. And we are saying, good God, look at all the country, corruption here, mash up health service, education in crisis. And the reality is, this is not a surprise. Every time you visit Jamaica, the same ghetto that was there 30 years ago is still there now. The same condition is there. The water will flow in the other riverbed before it flow out into it creates a new riverbed. That is inevitable, lass. So even although we say we want to see something different, people have to walk the road to learn the experience. Every day we see that in front of us, not just with people public as a group, but also individual in our family, people that we know. Sometimes you have to drive on pothole before you decide, say, don't drive on that road. Make the car mash up first and go through enough bump and sufferation before you're going to see something different. What is that difference? That difference is what we all would like to see. I go back to the manifesto that we talk about. We need a manifesto that speaks on health. But none of us are expert. None of us, we can talk about cutting back, reducing the departure of so many qualified Jamaicans in the health system, especially at the level of nurses. I suspect the doctors are lessly departing because they can make more money in Jamaica, even with the corrupt system. They go into private practice or they balance the two. They do some private practice and some public service. The doctors that are in the junior doctors cannot do private practice. They are suffering in a prison called the hospital, the public hospital system, like the nurses. But they will bear it if they know that when they graduate and get enough skills, they can go into something that earn them more money and allow them to live good, buy insurance, and allow them to go overseas to get the health care that they themselves have come through and are not going to use. It's a shame, but that is how it is. So my thing is, brothers, we don't have any sisters on the line, but we have sisters in the audience. We need to identify a manifesto that speaks to a third route, a third rock, riverbed, even though it don't exist. We know, we in this group, and we who are thinking down the road know that if it continue like this, the next riverbed that going to start come down is the PNP riverbed. Is it going to lead to something different? I can tell you right now, based on how they are behaving, whether it's 14 men in the house or women, or 10 men in the house, or 5 men in the house, they're not behaving anyway like they are showing leadership, or that they are showing even less that they are going to carry the country outside of the current PNP riverbed. What is that PNP riverbed? Swap dog for monkey. Same system, but a different man run it. Same politician, but a different minister.
But
Same
again,
laws, same everything, except is now a different set of man run it. Is that system going to benefit the grassroots people?
but
No.
Again, John, we need to stop asking the questions and start looking at what the solution has to be. And the solution has to be one of accountability. That's what it has to be. Accountability is the number one factor in any system of organization,
But
right? Because from accountability, that you have responsibility.
Here's the problem with that, Patrick.
What do you mean by that? Look for accountability without the people being themselves in charge.
I said it earlier. I said that if we're looking at the direct subject that we are on now, right? I mean, even though it apply across the board, but looking directly at the subject we're dealing with right now, right? As I said before, it's nothing new, right? Let's go on and explain. This is something I come through the various decades, right? And we can't be doing the same thing over the several decades expecting a different answer. That's madness.
Let me say something, Patrick. You see, we have been talking, and everybody in the political sphere in Jamaica has been talking about accountability. And we are talking about accountability in a system where less and less people are participating. We are not going to have accountability, real accountability in a situation like that.
Why not?
Because for accountability to take place, you have to have people holding other people to account. And if less and less people interested in the political system and less people participating in the political system and less people participating in the runnings of them community.
What do we do in the meantime? Sit down
Hold
and
on,
talk?
John. If we have less and less people participating in the political process, what it means is that there's less people to hold government accountable. What we need, right? And this is something that we can try to stimulate in the communities. We have contacts and people can do on them own. They have to build their own community organizations.
Correct.
Right? They have to go back to the days. They have to go back, people in Jamaica who talking about accountability and talking about change. It will forever be only talk. Because in order to hold people accountability, you have to have some form of organization. You have to have some form of bringing people together to put some force behind what you're saying. And the only way we can do that, and the only way Jamaica will be able to do that, is to go back to building these organizations that can talk out, that can organize them community and organize protest and whatever else, right? To hold people responsible. And we're talking about building their community organizations, building the youth clubs, building the citizens association, building the parent teachers associations. Because if you have in a community or in a constituency 5 schools and you have 5 parent teachers associations that come together around a particular issue, that can bring and put pressure on a councillor, it can put pressure on an MP, and it can bring awareness to a whole heap of problems, right? So what I'm saying is that we're going to have to move away from just saying we need accountability and hold people accountable and all of this kind of stuff without encouraging people.
But that's precisely
to
what I
build
said.
these organizations, because these things don't go and come in a vacuum. You have to have an organization and organizations in place to hold people accountable.
Right, but
absolutely last. And,
right, where we are.
The fact of the matter begins, right? That it begins with each and every one, not some, everybody, right? Because everybody has to commit to what they intend to do? What will be their part?
Let me just make one other point, Patrick, because
that's accountability. That
let
is
me
the
make-
accountability.
let me just make one other point, because a lot of people, I think, believe that in order to be politically active and to bring about political change, it's about just building party organizations. Some people believe, say, okay, we need to get rid of the government. So we need to join with the PNP and join this political group and join this party group. That is not the only thing, because sometimes the community organizations that are independent of the political parties can have voices that is stronger, right? And have organization that is stronger in influencing the people inside them communities, even better than some of these political groups and organizations. And they can also join forces with the political groups,
Let me
right?
say
Because if there is a PNP group in a constituency, and this PNP group also can work together with the Citizens Association and the Parent Teachers Association, if we had that kind of vibrancy taking place, Andrew Holness at this time could not be trying to hold on to power with all this corruption and all this nonsense surrounding his name. And the JLP could not be getting away with so much. And so little is being said, and so little activity amongst the people. Because what we need now is activity. There is no question, regardless of we saying or me saying that you have a history of certain political deficiencies from both parties and whatever. Right now, we need to get rid of this government, right? And we need all the forces possible to do it. So when people sit in Jamaica and look at the situation, capping out is not the answer, right? Capping out is only causing the thing to build and build and build and build. We don't know how far it's going to go. It's about organizing and participating, right? And making the voices stronger, right? And when the voice is stronger, the voices can put pressure upon the PNP politician to do more of what we want them to do. Because it's not just about bringing in a new administration to do what they want. What we're thinking about is you bring in a new administration, but you have some pressure to make them do and listen more to what the people want, instead of them coming and feel like, say, okay, them give me them vote, we can relax and we can wait out the next 5 years. And when 4.5 years come, we can run the community and do a thing and get them back together again. You know.
What you're saying, though, points directly to constitutional reform in terms of how you hold them people are accountable.
Everything builds to
But Mikey,
everything builds to
Mikey,
everything builds to constitutional
it touches
reform.
on constitutional reform, but a lot of the things that is needed has nothing to do with the constitution. It's
No,
about
ultimately it does.
ha,
Ultimately it does.
huh?
Ultimately it does. But that's not where we are right
No,
now.
what I'm saying,
That's not what we're
Patrick,
talking about right
these things that is needed, we don't have to wait
now.
on
Exactly.
constitutional reform process to do them. These
Exactly.
are things that can be done, right now.
Immediate action.
But the politicians, they are not listening.
yeah,
But
but I
we're
don't
not waiting on
understand.
the politicians to listen. That's the whole point.
Okay, John,
That's a point where Lassa put forward, and that's all I've been saying. Right? That it has to begin with the individual. Right?
Yeah,
Realizing that, listen, I need to raise my own awareness and I need to participate. And that is something which everybody has to start developing. Everybody. Not,
yeah,
not,
you
not
know,
just not just a few, not just the 30% were vote the last time.
Yeah,
Right?
but
Look here,
gentlemen,
John.
eh?
Go ahead, John.
Yeah, I don't, this is very abstract to me. You know, I don't think we're on a different level. The question I ask myself is, what can a group like this, which have influential people, with have a view about how the society currently stay, do to help bring about the things that we're saying need to happen?
That's what
One
we're
of
doing
the,
now. That's what we're doing
yes,
now. That's
that's one
precisely
of,
what we're doing now.
right. Can we do more?
Yes.
Yes. And one of the things we can do more is educate, how to help educate. We are doing that now on this program, but we can also do it in terms of the manifesto which we have been speaking about.
Absolutely.
Where we can say what is required to have a health system that people can have control over. Right now, there's no control. Good God, it is like rotting down. And the more you guys talk, is the more I remember. I had an incident. I won't be very, very vivid. I had an incident happen to me in Ferry about maybe 20 years ago, and I had to take the lady to KPH to get treatment. And I carried the lady down there. The difference with that is at that time, your brethren as a man known in the community who went to university and know whole heap of doctor who working in the system, I could take up the phone and call and ask certain doctor that work at KPH to look out for that person and tell me what was going on. She got smooth transfer, everything. But this was a lady who them drop her in Ferry. The family were living in somewhere far from Ferry. Drop her in Ferry, and she just have dementia and walking on the street. Walking on the street. I remember this very clearly. But if I go to KPH tomorrow, it's the same condition. I went to visit a friend when I was in Jamaica in April, and went to private hospital. What you call the one in front of Devon House there?
Andrews.
Andrews Memorial Hospital, just above Devon House. And my brethren, he passed away. He passed away because they did surgery. The surgery wasn't successful. He readmitted. They release him because they need the bed. And then him get readmitted again. Good God. And when I went there, he was unconscious because they just had to do another surgery to fix what they did in his brain. And I had to just leave a message with the lady that was, taking care of him. So these examples, gentlemen, only confirm the state of institutions that the people depend on. If you don't have money and you cannot leave and go somewhere, or you don't have money to go to a private hospital where you can get reasonable care in an emergency.
Dog nyam your supper.
Dog nyam your supper. What a thing that nothing don't change, man. I mean, it is so repulsive.
Well,
And
I wouldn't say you're totally correct. What has changed is that we have seen the politician and getting fatter.
I was about to say that. That is the only thing that has changed in Jamaica. The top 1%, including the political elite, are living higher, better, have more authority, have more links, and can do what they want to do. And in impunity or with impunity. How can this be right? So our demand for constitutional reform, control, accountability, about accountability cannot happen unless it is the people that you are accountable to. How can the people become the authority of their own destiny? It requires a transformation of the system. And therefore, my first step is the People's Manifesto, that we should be looking to put in something, a document like that, in place to help to bring about a re-education. What is the purpose of organization? Back in the day, we had, well, the junior doctors is still around, but that's it. There's no control over the hospital system in terms of boards that are accountable, that the people have control over in the community. KPH and Bustamante Hospital for Children and the University Hospital are not under the jurisdiction of the communities that they serve. They're not. It's just out there with the same thing. If you get sick now, you must bring bed and sheet.
But John, hold a minute there. Let me ask you this. Right? Let me ask you this. Because again, we're talking about now, what we can do now. Right? And again, I know you're throwing everything on the kitchen sink and everything, right, in the mix. But we're still talking about the hospital situation. Because no matter how much things we pile into it, right, we're not going to address everything all at once. Right? But since we're talking about the hospital situation, let's talk about that. Right? Let's stay right there and talk about that for a minute. Right? And what has to be done. The first thing has to be done, as I said before, right, is that we have to call the hospital administration to account. They have to be accountable. What are they reporting on? What are they administrating over? They have to have some. What is the report they've been presenting? If they do present a report on an annual basis, do they present a report on an annual basis? What is their statistics? What is their records? Right? They have to have records. Right?
But Pat,
are they seeing?
Pat, if I can interject, when that young lady that was passed around between Andrews to UWI and she ended up in Spanish Town and she bled out, she died, right?
A patient,
yeah. It was it happened around Christmas time, maybe about 5 years ago. I don't know if you remember that case. But it was on TV. It was all over the place. And she, everywhere she went, they thought she had COVID. That was the problem.
She was pregnant too, right?
And she was pregnant, and she never had COVID. But because they thought she had COVID, they kept passing her around, trying to put her into a public hospital system. And she finally ended up out in Spanish Town, and she passed away. Right? Now,
that wasn't somebody from the airport or something like that?
No.
No. I was trying to remember the name of the lady. But
I remember that clearly. I remember the incident here.
Remember that last, yeah. But the problem was the administration was never checked upon. There was no firm regulation governing a private hospital versus the public ones, right? And the culprit there was the Ministry of Health. So in
Because we
both,
just to the Ministry of Health.
yeah, in both cases, private or public, the Ministry of Health, if you
course.
don't have a regulation that
Listen,
says, here's what you do.
It is as simple as this, Herb.
Yeah.
Every medical personnel has to have some form of license, A person don't just jump up and say they are a nurse or they're a doctor, right? Or they're an administrator or whatever. Everybody has to be certified somehow.
Yeah, but in this case, it was
right?
governance. It was the governance of the
that's how
institution.
it begins. That's how it begins.
Yeah.
That's how it begins. Right? So it has to that in itself, right, is a step in accountability. Don't narrow down accountability and think that accountability only means numbers on a paper, right? Or how the report reads.
Yeah, the problem we may face with the whole issue of accountability in these public institutions in Jamaica. This is somewhere people are talking about year in, year out, and it's stretched back decades.
Before you born.
You have all kind of government commissions that talk about
study and give
report. Study and make recommendations how to make government departments and public institutions more accountable. The recommendations are there, but I don't think it's by accident that you don't have, like when you have contracts or anything going on, are people signing off on certain things in certain departments. You don't have somebody else checking on them and making sure them have to verify this and some. It's not by accident. When you have a corrupt system, right, and people want to make sure that the corrupt system is there so them can benefit. No matter how simple the recommendations are by whatever commission or by whatever group, it is not going to be implemented.
Here's the thing, lass. Here's the thing, though.
Let us finish.
The moment the process begins where they are brought up to account, that is what makes all the difference, Because that is the fundamental difference in the private sector, In the private sector, right? What happens is that the owners of the business, right, want to know how the business is being handled. That's what the report has to reveal, and it has to reflect that, right? The moment it starts reflecting that, and them call up the accounts, right? And the CEO are the operations, are the finances, are the whichever department, right, is not being held to account, right? Then them have to take action. Them get rid of them, right? Or them carry them to court or whatever steps they need to take.
Yeah, but Patrick, for us, regardless of how small it might be, for us, accountability comes by way of the election.
No, that's a big mistake.
Can you allow me to finish, please? Accountability in our context come by way of the election. That is what they told us, and that's what we've been practicing. The question, though, is in terms of constitutional change, and accountability, what exactly are we asking for? We're asking
what you were last said earlier on.
Yeah, listen, let me finish, bro. We're asking for term limits. We're asking for right to recall. What more can we ask for?
We ask for community councils.
Yes.
No.
We
No.
ask for, and that all of that is what it is referred to as people's organization.
Yes.
It cannot occur in a dormant public. A dormant public, in other words,
Precisely.
it's part and parcel of a changed attitude among the elector, for want of your term, the electorate, where it's not just during election time that you have governance, but you have governance like with the schools, with the hospitals, with the roads, with the repairs in the communities, whether it's done at the local government or at the federal government or national government, we would call it. The way that works is that it's outside of a dormant period. My attitude is, and where I agree with Lass, is that in a period of calm, in a period of what we are angry because things are so bad, but people are very dormant. We cannot get angry. We cannot do more than what we can do. And one of the things we can do, is realize that this is the reality. It's just like the people vote for Trump. No matter how much we never want Trump, that's who is here. What you going to do? Either you're going to leave or you're going to stay and work with what you have.
And running away is not a solution.
Right. Running away technically is not a solution. And it's good for us to say that, but we're not living in Jamaica at this point. And I only have a problem when we lose track of the fact wherever we live, it is the people's decision to change the future.
I like that comment from Don. Right, in the audience.
You want to respond to it?
Right. Yeah, she really would have liked for call in. That's the whole point. We really wish you could accommodate her.
Okay.
By calling in.
Yeah, we should try and set it up. We can't set it up today, but
she's on point. She's on point because Spanish Town Hospital, that is a classic example too. Spanish Town Hospital is a hospital, but I remember back in the day, back in the 70s. You know what them used to say about Spanish Town Hospital? Them used to say if you're ready for dead, go to Spanish Town Hospital. Because everybody was going there alive, come out dead. Right? No patient not going there alive and come out alive. That's the reputation the Spanish Town Hospital did have. Right? It's a long time I don't even hear nobody mention Spanish Town Hospital.
Well, you just heard.
It's so on point.
Well, as a man who graduated with many doctors, not in the medical field, but they came through the system when I was a student, and know many of them some of whom were at in Spanish Town Hospital. And I understand, but in the absence of accountability by the communities in which these hospitals exist, we're going to have this problem over and over. The only way the solution to it.
See, Johnny just put up another comment again too, right?
Yeah,
referencing the human doctors and things. That is accountability.
Mikey, we are give prominence to certain kind of views.
It goes, Mikey, put them up.
I'm listening. It's just the different views, you know.
Yeah, well, that's what you want. You want to have different views, but we have to recognize that these views are like our views. In the absence of movement, of getting together, of advocating for a different system, we're going to always have this system. The local organization need to be more active. How do you get them to be active, Lass? That is the question. How do you get
That
the
is to Delroy's point too. How you get them to be active
right?
is an educated electorate,
What does
right?
that mean?
Becomes an active electorate.
But yes, and how do you get them educated? Let me go carry the question right through like an onion, peel off each piece.
That's one of the things we talk about here. That's one of the things we do here.
But but
We
Do
deal
you
with
agree
talking.
with
We're
that,
not talking
Herb?
about wholeness on them. We're talking the ordinary people. We're talking in terms of them understanding that everybody needs to step up.
Correct.
and here the problem with sometimes we talk about education and
Yeah.
we think like say education is just like programs like this and the manifesto and all of those things. But
It's
my,
more than that.
huh?
It's more than that.
It's
It
more
is
than
more
that.
than that.
Yeah.
And my emphasis in education and where the emphasis should be is there's no more better education than involving people in organizations. And for example, a person who is part of a parent teachers associations, it is not like telling somebody, boy, come join this political organization, come join this cause because of whatever. But in organizing and dealing with issues in a parent teachers association, it is where the parent and the student can come upon
And
the
the teacher.
challenges to change inside of the school system and inside of the community and become aware. So when we talk about the youth club and with parent teachers associations and whatever, we're also talking about education because this is where the persons who involved in these simple organizations go and get educated because every time them touch a issue or have an issue to deal with, them come up against the challenges of the system and it make them more aware. Them
Correct.
don't have to be
There's no question about that.
there's no you don't have to we don't have to think that boy, we have to try tell a man say he have to be JLP and he have to be PNP and he have to deal defend this political cause. Organization in itself inside the communities, no matter how simple it is a way of educating people and getting them involved. And I think that because a lot of these systems, a lot of these little organizations, simple organizations, have been absent from some of the communities
Grassroots.
because of violence, sometimes because of people preoccupied with making money
Survival.
to survive. Numerous reasons. We see more and more that the thing fall and the government representative, the councillor, the MP, the whoever, we asking them to govern themselves, to have some integrity. We shouldn't be asking them to have integrity. We should be making demands, right? That's what the community should be doing. The community should be making demands.
And it's not making demands integrity either, because if they have no integrity, we not ask them for have none. We get rid of them.
No, that is it. The community make the demands, and if they can't live up to the demands, you get rid of them.
Well, let me ask you this. It is obvious that that's not happening. So the question is, what do
We
we
have to
do?
encourage it. We have to encourage it, Mikey.
Yeah.
We have to encourage it through talking, and if we have influence in amongst people, we encourage it. People who have influence in organizations and communities, we encourage it.
I'm in agreement with all that, but my question is, what do we do with someone like Coolness? How the people, other than wait for the election, what else the people can do?
That is just what we're saying.
Listen. One of the things you have to understand is this. to the degree that people understand what needs to be done, Andrew Holness, day of reckoning is coming.
With so much billion him spending on the road
It
work.
is coming. It might come shortly. It might take quite a while. But as sure as nightfall, the day it's coming.
Let me hear the
But
others.
that is subject to what people are prepared to do. We can sit here and determine when it is gonna happen, how it is gonna happen, who is gonna make it happen, or anything like that. The only thing we know is that if people start wise up, right, then you're going to see action for change.
Herb, let me hear your voice, Herb.
Look, the day of reckoning for wholeness is dependent on the judiciary. All right. The judiciary is where they've moved the legislative action, where his own people in parliament should have voted to discipline him, but they don't have the discipline themselves to do it, right? They're not conforming to policies, procedures, or laws of Jamaica. They don't see it that way.
Why?
Why they not?
Why do they ignore those things?
Because they're powerful, Johnny.
Correct. Why are they powerful?
Because the people gave them that power, and the people have to take it away.
All right, that's one way of putting it.
We can't sit here and pine over wholeness any longer, because wholeness is running the gamut. He is playing the long game, and like we said in the past, he's trying to run out the clock.
What clock?
The clock on his term. If he serves the full term and he has all this money and he makes a decision, look, I'm not gonna run anymore, and I'm moving to St. Lucia, or I'm moving to Barbados, or wherever he wants to move to.
I'm moving to the United States.
No, that's not gonna happen, because then the US gonna send his ass right back.
No, them not running.
If look, I just put out an article. I don't know if you guys read it.
Yeah, I read it.
But the FBI is now going to be involved. FBI International Squad is going to be actively involved in helping the Caribbean countries to prosecute their criminals, and this includes, politicians and everybody else. As a matter of fact, Trinidad, who is the lead for security in CARICOM, Trinidad, the Prime Minister, praised that move because he's been asking for it for the longest while, right? And they also passed a law in CARICOM that will now prosecute you wherever you run to, whether it's CARICOM or other parts of the Western Hemisphere, right? CARICOM will help to bring you back to your country of origin and prosecute you in that country. So with the FBI being active and with the CARICOM being active, to me, you have too many strikes against you for you to run anywhere unless you run into Russia.
But is it just a press release that they're going to do it, or something they're actively doing?
They're actively going to be doing it.
The FBI.
Yes. They're going to be doing it. And to me, that is a bad sign for wholeness.
Yeah, but let me ask you this. For them to come in, you have to invite them into your country. They can't just come in like that.
Now, if Jamaica and everybody else in CARICOM sign on to this law that CARICOM now has, do you need permission to come into the country, or they're going to exercise jurisdiction under that new law?
I'm looking for the note you posted about that, and I don't see it.
Yeah, it's in the
I will endeavor, John, to make sure you get it, because I thought it was very.
I know why. let me put it in, John, so you can do it. I know why it happened.
Okay.
You see, my thing, everybody been talking about accountability, accountability, accountability. And there is, I think that I think the tendency in Jamaica right now is just people just avoid, is avoidance. We don't want to deal with them, so just stay far from them. Them
Well,
done corp
it's
already.
a lack, Mikey, it's a lack of enforcement. Who has the capability to enforce? You have Mocha, right? That is supposed to be independent of the JCF and have the capability to enforce. And Mocha has done nothing. They have Mocha running down cases that JCF should be able to do themselves. And the big cases where Mocha can go after people in the PSOJ or high up in government, they're not allowing Mocha to do that.
Why? Why?
Because they still come under the control of the Prime Minister and Minister Chang.
Oh, okay, okay.
You see what I'm saying? It's just like FBI here. The head of the FBI can serve 10 years based on the law that was passed, but still Trump is throwing out two different FBI leaders less than 10 years from their tour, right? If you don't respect the law and if you don't obey the law, and if Congress sits on their hands and allow him to do that, that's the same thing happening in Jamaica, right? The law was passed that gave independence to Mocha to prosecute anybody, to follow cases to the ends of the earth. And they have not been able to do so simply because Chang and the Prime Minister control the purse strings and they control the head of Mocha, Colonel, what's his name, Turner. They control them. You know, how are you going to get out of a situation like that unless you sign away your rights of control and you put them firmly maybe under the Attorney General? And so the Attorney General controls them. And that if they violate the law, the Attorney General makes that determination and send them out to make an arrest. You can't keep playing games like this, man. I mean, but they have to be serious about enforcement, and they're not serious.
They're not.
No. I mean, the investigation on wholeness started from 2018. That's what the IC did. When in fact, Holness had this ill-gotten gain prior to 2018. And then they came in at the end of the investigation in 2021 and make a statement that they can't go any further unless FID can establish where he got all his funds and everything from. Well, that's the first thing you should have established before you did the investigation. Where did the funds come from? Right? So now we're waiting for the court to rule that the FID can, in fact, go ahead and do that part of the investigation. And then whatever the results come out as, then they can go further with the prosecution of Holness.
Okay, gentlemen, from just listening to the discussion, it's clear that the Jamaican people find ourselves in a dark hole, between the rock and the hard place. We are up against a bunch of thieves who have captured the state and making themselves rich.
Yep.
So I am in agreement with everyone here. The question though is, can we wait until the general election in Jamaica to make that move? Because it seems that that's the only way out now. We have to mobilize Jamaican people to turn out and address these things,
Mikey, if you recall, when I made mention of more radical moves, right? Whether or not a government can be overthrown in Jamaica.
I think I need to get from my
You
non-disclosure.
play your disclaimer down the bottom.
Yes,
Right, John? John, can a government be overthrown in Jamaica?
Yes.
See, it's that simple. It's that simple.
Only on condition that the masses of the people are behind it.
Yeah.
Okay. Well, for those who are not aware, at the bottom,
Sometimes it happens without that.
at the bottom is my.
Disclaimer.
So let everyone be clear. You understand? But regardless of disclaimer,
I think our host just ran for cover behind
well, you know, we are getting into that season where
Hey,
everybody
don't-
wants to sue
It's
somebody.
not a relevant point at the moment. Our concern is the lack of activity,
Yeah.
even to form community organizations
Yeah.
among the people. So let us ask realistic questions.
Yeah.
If that question is abstract and have no bearing on what's going on at the moment.
Well, the question, though, for me, is will the people be mobilized, and how do people mobilize to stand up and take that accountability part?
Mikey,
All we can wait is wait until the election. That will prove.
No, I don't agree with that.
Last, I would recommend Mikey goes down there and get things going. Start at the university.
be careful, Mikey. Man, you see it in other local newspaper that some foreign people are trying mobilize. Because it's election time, and people draw all kind of card when them ready,
Yeah,
brethren.
but Brethren, it is obvious that participation in the election is going down. It's going down.
Yeah,
Only
but you
Yes.
can't avoid, Mikey, whatever the state is of the people, you can't wish something different.
No, what I'm saying, John, is that while that is going down, the vote participation is going down. Wholeness has a ton load of money, and you see him start to spend it through the road program, bribing the Jamaican people.
Therefore,
Are the Jamaican people that stupid, or they're going to be remembering everything they're supposed to recall come election time?
Regardless of what happened, you saw the conference, JLP conference. It was well attended.
Yeah, but that you know the thing run with the
What that
political
says is that
parties. Them bus attendance is not a significant measure of
Support.
the meter of the country.
Acceptance.
Them
Right.
bus people from all over the place, so it's
But
nothing.
the thing about it still is that we cannot guarantee anything coming out of a good attendance
Yeah,
at a JLP conference
at no party
or
conference at
a
all.
PNP conference, at any conference for that matter. It's not. It doesn't guarantee anything, right? It is just an indicator that yes, there's still support for them. That's it. Nothing else.
And therefore, this tabling of the constitution in the parliament for a republic mean that Jamaican people going to go with that?
It's possible. We don't know.
yeah,
But
but what's wrong with the
We
republic?
can't sit here and determine none of that.
It's a move in the right direction to go with a republic. What's wrong with that? I don't understand the question.
No, but we can't determine none of that right now. I mean,
I
all
think
of
what,
this
what
right
Mike
now
is saying, if the Jamaican people can be satisfied with only that
Of
as
course,
constitutional
that's
reform.
That's a question.
Yeah, but you can't determine that.
but
We cannot determine that.
Again,
Yeah, but you can
again,
have
the thing
system.
about it is that John said it earlier, right? Particularly in a state of dormancy amongst the
You actually quote me, Ross.
general public, right? I mean, what can you say?
Well, I can say you look at the disclaimer at the bottom.
Yeah, but that now save you. You come ask question about overthrow government. We're not into that business.
Okay. Well,
Marky sound like him just realized we're not in that business, John.
okay. Because you know, John, you know, yes, you know the school I am from, you know. So
Oh,
I want to change, you know, and anywhere the change from, I'm for that. But I see
oh,
one thing is clear: Jamaica is in a crisis. JLP
Yeah,
is
but
in a
you keep
crisis.
saying that as if that means that everybody agree with you and everybody is acting in as if things are in a crisis. That's not
I,
how it's out there.
I think people realize it, and what they're doing is using their feet. They're
Which is
avoiding
what? Which is
avoiding, you know, upfront coming out. If they get the opportunity to go foreign, them
I
gone.
don't agree with that. I don't see
But
that.
let me
Just
ask you a question, Mikey. Let me ask
yeah,
you a question. I direct this question directly to you.
yeah.
If, let's say in your household, right, a crisis arises in your household, what do? You take steps to address the crisis, right?
That's one approach.
Okay. Is there another approach?
Yeah, you can run.
Would you run?
Well, I might not. Depends on the crisis, the nature of the crisis.
No, when I say not any crisis in my house. In my house. No crisis now run me out of my house.
Well, I can't say that.
No, I'm saying that.
Yeah,
I am
okay.
saying that.
I
I'm saying
understand you're saying that, but I
yeah.
cannot say that because there are crisis and crisis and crisis. You know, and some of the crises are much deeper than some.
Well, any
And,
crisis.
and when the crisis come, you lack the resource, so you have to look on another way. And I think that's what the Jamaican people are doing just now. They recognize the crisis, but they're not at that stage where they're going to confront the government. Yes, you will see that in some areas, you know, people demonstrate and then protest against the police and what have you. But the collective spirit of the Jamaican people is not at that point as yet.
It's nowhere at that point.
Nowhere.
Nowhere.
Nowhere. I think what they're doing now is using their feet. They come a foreign or them hustle.
Yeah, but that's
Coming
not
up fine
using
is
the
not a
feet.
guarantee or anything.
What do you mean by
No.
using the feet? You mean to leave the country?
Yes.
But that is only a certain set of people.
But
John. Everybody in
even so,
Jamaica.
John. The thing
John.
is that
John.
flight is not a guarantee.
No, but John, I can tell you this. Almost every youth in a Waterhouse, I tell you, say, oh, listen, he want to run through the border. That's all the expression is. He want to run through the border. You know which border I'm talking about? Mexico.
Yeah, well, worse now.
Well, but I'm saying the sentiment, the number of calls received.
You make Herb laugh.
No, but it's real. It's real. It's real. A
You
lot
make
of
Herb nearly jump off him chair a while ago because after next month, the run through border business is worse.
Herb, you know of it, right?
It done, it gone. Right? The man say enforcement starts day one. So I don't know who gonna run. Look, our
Well,
people.
Hey,
here's the
listen,
thing. Here's the thing.
I get an email.
Here's the thing. Here's the thing we have to understand. Right? Again, talk is cheap. Right? Man can't say anything, no matter who him is. Right? But the fact still remains is that run through the border is not a solution.
Nah.
Because it doesn't guarantee anything.
No, well, that's a solution. Now, what the question, what is happening is a trend. That is a trend.
That is the talking trend.
No matter trend or no trend.
The talking trend.
Right? Because ignorance brings trend to, you know.
The talking trend.
Yeah.
Have no reality on the ground.
And man no better for talk. Him say whatever him feel like saying.
Okay. But I can tell you though, that in Waterhouse there's a movement towards that. Every youth, most of the
Yeah,
youth,
you hear them talking.
Not just Waterhouse,
and
Mikey.
not just
All over
Waterhouse.
all over the
When
place.
that block,
And it's not new either.
You
when
know?
that block, like other trend,
It never take
it's
nothing
like
current
a
them
kettle.
arrive at that position. That's been a long time thing.
When that block, like a kettle, right? That pressure build up, build up, build up, and
It
there's
was
no
pipe.
release, no release.
Make pipe boss.
Pipe bust.
Well, on that note, gentlemen, I want to thank you very much for another lively discussion. You know, and I hope the listeners learned something from what was shared today. I must say that last week we had a very wonderful broadcast. You know, by the time I sign off from the broadcast, I had over 4,000 viewers. You know, so the folks enjoy the discussion. Whenever time we look at the news, discuss what is current, it seems as if there's a excitement for that. And I want to thank the listeners and encourage them to like and share this platform. And remember, we are here every Sunday at 4 o'clock. This probably is the only place on the YouTube channel where we discuss Jamaican issue rather than get into the cost. We try and find some solution and provide some advice. So, brothers, thank you again. Listeners, thank you again. And
Yes, sir. Yes, sir.
we'll meet here next Sunday at 4 o'clock.
Yeah,
Remember, it's Waterhouse Vibes.
and Mikey, I did put in the information. I think Pat might have done it too.
Okay.
The one with the FBI
Can you
and
see?
the one with look in the private chat and you see it out, and I put it out into the audience also.
Okay.
The
All right.
FBI information and the new you can run but you can't hide in CARICOM.
Okay. All right,
All
man.
right.
Thank you very much.
Essence.
That is the one with the homicide.
Yeah.